Good afternoon, everyone. My name is Kathleen McDonnell and I work as a specialist registrar in the Health Service Executive. I'm delighted to be here today to present this recent work on adolescent age of first alcoholic drink and associated parental factors in the west of Ireland using the Planet Youth Study 2022. So just a background, as we all know, alcohol use is a growing global health issue. And adolescence is a transitional stage of development from childhood to adulthood when adolescents may choose to use substances such as alcohol. Alcohol use or consumption at an early age can impact development and result in negative health outcomes. The younger age of first alcoholic drink is linked with increased alcohol consumption, binge drinking, alcohol dependence, family issues, and risky behaviours, to name just a few. Regarding parental factors in adolescent alcohol use, parents can often be providers of alcohol to adolescents in the home, for example. It can be perceived by parents that early sips of alcohol can be protective or maybe inoculate them from problem drinking later in life. However, a literature review on this subject matter identified that parental factors are associated with alcohol use, in particular the parental supply of alcohol to adolescents, parental alcohol consumption, parental problem alcohol use, in addition to parental tolerance of adolescent drunkenness. There has been an increasingly concerning trend in 3 consecutive Planet Youth studies in the west of Ireland where parents have increasing tolerance or increasing acceptability of adolescent drunkenness. There is a gap in the Irish context with regard to an evidence base regarding the relationship between parental factors and adolescent alcohol use, and this research aimed to address this gap. It aimed to describe the age of first alcoholic drink among a cohort of 15 to 16-year-olds in the west of Ireland using the Planet Youth Survey data 2022 and investigate the relationship between adolescent age of first alcoholic drink and parental factors. Briefly, the Planet Youth study is a biennial or every 2 years run comprehensive lifestyle questionnaire among 15 to 16-year-olds in the west of Ireland. It asks on questions regarding substance use such as alcohol, health and other categories. This was a cross-sectional study, a secondary data analysis of the Planet Youth 2022 data among a study population of 15 to 16-year-olds in all secondary schools and youth reach centres in Galway, Mayo and Roscommon in the west of Ireland in 2022. The response rate was quite high at 67.7% with almost 4,000 or over 4,000 respondents. Analysis included descriptive and a multivariate multinomial logistic regression using SPSS software, and the dependent variable was adolescent age of first alcoholic drink, and sociodemographic, parental alcohol and relational factors were the independent variables. So some key findings. So with regard to age of first alcoholic drink, almost 75% of the 15 to 16-year-olds who responded said they had their first alcoholic drink already, with almost 20% reporting they had their first alcoholic drink at the age of 12 and younger. When stratifying this by gender, you can see in the left in the never have drank column, in the blue, which represents males, males were more likely to never have drank when compared to females. And at the younger ages of 12 and younger and 13 to 14, females were more likely to have had their first drink at that point compared to males. Using the regression model and after adjustment, this was, reconfirmed through the analysis. So you can see that males had a higher odds of never having had their first drink at the time of survey compared to females, and had lower odds of drinking at the younger ages compared with the females. Regarding parental alcohol factors, so from the survey, approximately nearly 12% reported that their parent had a drink or drug problem. Over half reported that they had ever drank alcohol at home, and over a third reported that they had ever been supplied alcohol by a parent. Over 1 in 10 reported that their father had become drunk at least once per week, as per the survey questionnaire, and approximately 7.5% reported that their mother had become drunk at least once per week. Looking at this from a regression analysis perspective, so looking at parental alcohol factors and age of first alcoholic drink, you can see highlighted that those who reported never drinking at home had a lower odds of having their first drink at the younger ages of 12 and younger and 13 to 14. Those who reported that they had never been supplied alcohol by a parent had a higher odds of never having had a drink. Those who reported that their father got drunk at least once per week had a significantly higher odds of drinking at the younger age of 12 and younger. Those who reported that their parent had a higher tolerance or a higher acceptability of adolescent drunkenness had a higher odds of drinking having had their first drink at the younger ages. With regard to some parental relational factors that were assessed in the study, you can see here highlighted that those who reported having adequate parental supervision and having easy or very easy access to parental advice had a lower odds of having a first drink at younger ages. Those who reported that they never spent time with their parents had a higher odds of drinking at the younger ages of 12 and younger. So some brief strengths of this study. So it was a large sample size, which increased the precision of the analysis. It was a high response rate, which was representative of the target population. Conclusions drawn from this research can further inform hypotheses for further research. The limitations: this was a cross-sectional study, and temporality, or a direction of time connection between the associations, cannot be inferred, or causation can't be inferred. The survey was self-reported from an adolescent's perspective and that introduced a recall bias. In addition, the parental factors were measured from an adolescent's perspective, which introduced a measurement bias. This was not a national survey, so it's not generalisable to the general population in Ireland. So just to conclude, there is this study, I suppose, identified that there is a high prevalence of adolescent early alcohol use in an Irish context, with the females being more likely to drink at the younger ages compared with the males. And there are significant parental alcohol and parental relational factors identified that influence adolescent age of first alcoholic drink in an Irish context. There are a number of public health implications from this work. There is a need to continue to raise awareness of the harms of adolescent alcohol use, in addition to the parental factors that may influence this, to continue to implement and develop public health policy that protects adolescents from the harms of alcohol use, to use research and data to advocate for legislation that fundamentally places adolescent health at the forefront and protects them from the harms of alcohol, and to continue to invest in research and work together to inform public health policy and alcohol reducing harm initiatives in future. I'd like to thank the following people and areas for their support with this work. Their support was excellent and really helpful, and without their support this work wouldn't have been possible. Thank you all for your attention and for your time today. Happy to take questions, and if anyone has any follow-up questions, my email is on the conference booklet. Thanks to everyone for organising the conference team for organising the conference. It's been great, and here's some reference that have informed that work.